Hi, it's Rachel. I'm going to be doing a cardiovascular assessment on my patient Peter, who is right here. So the first thing I'm going to do is I'm going to scan the room for you. Yes, I have a creepy mommy here. He will not help me to cheat, don't worry. Yes, it's messy. I need to fold that wash. Actually, that's jackets, I lied. Anyways, so upon entering the room, I've already performed my hand hygiene. I've closed the door, closed the curtain. I'm going to identify myself to the client. Hi, I'm Rachel. I'm going to be your nurse today. Can I get your name and your date of birth? Perfect. Today I'm going to be performing a cardiovascular assessment on you today. So I'm going to be taking a look at your neck and your chest, and giving it a listen, giving it a little feel. Just take a look at you today. Is that okay? Okay, perfect. So I've already gathered my history on my patient just for the sake of time constraints for the video. I've already assessed for pain. I've already done a history, family history, done full any risk factors or anything like that before doing the assessment, which would kind of guide me during the whole assessment. So the next thing that I would do was while I'm doing all that history, I'm checking over my patient's demeanor. I'm noting any visible lesions or anything, any abnormalities, any redness, anything like that. And then I'm going to go ahead and ask permission to touch. Is it okay if I just give you a little feel just to assess your temperature? Perfect, thank you. I'm just gonna feel temperature, feels good. And then I'm not noticing any moisture or anything that's abnormal. Okay, and the next thing that I'm going to do is I'm just going to take a little look and just get you to lean back. Thank you. I'm just going to take a little look at the neck. I'm going to examine just to kind of see if I see any noticeable distended veins or anything, or any obvious like pulsations or anything. So I'm just going to take a look here. That looks good. Okay, and then the next thing I'm going to do is I'm going to take a little listen for bruits, which are whooshing noises. So I'm making sure that the bell is on. First thing that I would do is I would use an alcohol sanitizing wipe. Warm it up during the process, let it dry. And then while doing this, I can't hear myself while I'm speaking. While I'm doing this, I'm going to ask my patient to inhale, exhale, and hold it while I am listening for bruits. So I've noticed no bruits, no whooshing noises. So the next thing that I'm going to do is I'm going to palpate the carotid artery. And I'm going to be careful just not to be too hard to stimulate that. So this, you're just going to do one side at a time. So I'm just going to give this a feel. I'm going to note the rhythm, the rate. All that stuff. I'm going to compare both sides to make sure that it's equal bilateral. And that's perfect. All of that is great. So then the next thing that I'm going to do is I'm going to give an examine to the upper extremities, just more focused. And so I'm looking for any edema, any redness, any lesions, anything abnormal. I'm not noting anything. So then I'm going to take a look at the nails first, and I'm looking for any, first I'm looking at the color is pink, and I'm noting any ridging or anything like that, any clubbing. I'm not noting anything like that. I'm going to check the cap refill time. That's less than a second, so that's great. And so now I'm going to check the radial pulse. I'm going to compare. and that's normal. Now I'm going to check the brachial. I'm going to compare on both sides. You're always going to want to compare on both sides during a cardiovascular assessment. And you can compare on both sides at the same time except for doing the carotid. So after I've done the pulse sites, I'm going to check my skin turgor. And that's an immediate bounce back, so that's perfect, that's normal. That's what you're looking for with this. So then the next thing I'm going to do is I'm going to do a general inspection of the abdomen. I'm looking for any large pulsations or anything like that, any heaves, thrusts, or anything like that on the abdomen. I'm not noting anything like that. I'm looking for the aortic pulse. I'm not seeing one on him right now. And then I'm going to palpate for any thrusts or anything like that. Anything abnormal, find it. Then I'm going to go ahead and do my auscultation. So before I put these in, so I'm going to first start at the aortic, the pulmonic, the Erb's point, tricuspid, and mitral. Some brain fart for a second. It's like midnight. Anyway, so first, we've already sterilized this, but you can take another alcohol swab, clean it if you want to, warm it up, make sure it's warm for him. Just let him know what you're going to be doing the whole time you're doing this. So I'm just going to have a little listen to your heart. I'm going to use the diaphragm. So we're going to start. I guess I don't need to walk you through. I just kind of explained all of them. So I'm going to do all of those. I'm not going to actually listen for the full time because I can already see that I'm at 7 minutes. So then I would take a listen, flip it over to the bell, and then I would listen again to all those same spots, obviously for a long period of time, to listen for any murmurs or anything like that. I did not hear any murmurs, bruits, anything like that. I'm listening just now. And I'm so scared I'm gonna forget something. Okay, so after that, I'm going to feel for his pulse. So I'm gonna find that. I'm gonna get you to turn to your left side a little bit. I'm not gonna move them actually, but that can be easier to find it. So I found it. I'm noting that it's normal. Okay. And then I'm going to just listen and count it. Then I'm going to do that, figure out that it's normal, it's all good. And then after that, we are going to move on to the lower extremities. We're going to do all the same assessments that we did before. We're going to look generalized at the hair distribution and everything the whole time that we're examining him. So we're looking for hair distribution, any redness, any lesions, any abnormalities of any kind, like looking at his symmetry, everything like that. And so we're taking a look at him. We're going to look at his toes.